everything is done. We'll also be getting updates on the dynamics of the virus in the country. You know, we've heard stories of other countries where people have died in their numbers, but in Ghana it seems as though majority of the people who are positive will go on to recover and be fine. So what exactly is going on, and how does this also tie into the possibilities of easing the restrictions as long as we continue to comply by the measures, you know, staying at home if we don't absolutely have to go out, keeping our face mask on as when we are out publicly, washing our hands with running water and soap, and generally maintaining a social distance so that we don't catch the virus. They'll also be telling us about the case counts. Have the numbers gone up since the last time they spoke to us, or the last numbers that we have now that's almost making its way to 7,000, and the case management. You know, the last time we heard from them, they talked to us about getting more testing and isolation centers into most of the regions so that the minute someone is tested positive, we know how to handle them. We don't have to move them elsewhere. So I think overall we've done well, and throughout our viewing of listening to them, if you have any questions, let us know with the hashtag Breakfast Daily and reach us directly on our WhatsApp line 0550-585-832. If you're outside Ghana, the country code is +233.
Yeah, so generally speaking, I mean, I think that, well, we have 32 deaths now. Our numbers are 2,070 in terms of recoveries. That puts us just about 30%, which means that our recoveries as of last week the recovery rate, hasn't gone up beyond what it was last week when we were last on the show here. I think that for me, I want to find out what it is that we are doing that brought up the rate, up to 30% from when it was for a long time around 10-12%. And then what can we do to take it up further, if possible, to speed up the rate of recovery? Or is it just a limitation of the routine way we do our testing, that will keep our limit there? I want to try and understand some of those dynamics. So as they talk to us about the dynamics of the virus, it will be interesting to understand exactly what it is that is keeping our rate where it is. Is that a reflection of the true state of the management of our situation, or is it because of just the routine way and we're going to stay at 30% till we are done? That's what I would like to know. But yeah, I think that the cases are going up, and interestingly enough, it looks like the sample sizes are also not increasing. So it's an interesting thing. Not increasing the number of tests and samples that they are doing, but our cases keep rising. So what does it mean at the end of the day? Are we winning? Are we plateauing? What's really going on? And I think that would be good to know some of that. The cases across Africa have topped 112,000 now, across Africa, out of which Ghana's is 6,800. So we're edging towards the 7,000 mark. The death rate across Africa is 3,359. So that's quite high, compared to what we have here, which is just 32. So it looks like some other countries in Africa are not doing very well, as far as the death count is concerned. But fortunately, ours is still quite low, and every death that happens is an unfortunate situation, but we hope that it stays as low as this, and we don't go any higher.
So again, our case count still stands at 6,808. We'll give you the regional breakdown of that number. When you go to the Greater Accra region, 4,836 people are positive. When you go to the Ashanti region, 1,062 people are positive. In the Ashanti region, last time we heard from the Minister of Information, they told us about the special case in Obuasi where the virus spread like wildfire, right? So it tells us that we're not out of the woods yet. Same thing in Tama, where over 500 people were infected from one company. So as you're going out into your workplaces, it's important to not let your guard down, because a lot of us could be positive, but we are 6 people are positive in the Western region, 277 people are positive. Eastern region, 106 people are positive. In the Western North region, we have 62 people positive. In the Volta region, 47. Northern region, 36. Oti region, 26. And the Upper East region, 26. So today's presser will be hearing again about the status of the deportees from Kuwait. We'll be learning more about the dynamics of the virus in the country, as well as the case count and case management of COVID-19 in Ghana. We're going to hear from them and continue the show.
To our first press briefing for this week. Today's press briefing will provide us some updates on our fight against the COVID-19 pandemic. This morning, our briefing will focus on 3 topics. We'll first get an update on deported Ghanaians from Kuwait. We'll also get an update on dynamics of the coronavirus, and we'll get our final update on the case count and case management as well. As we are aware, last week, Cabinet took a decision to admit about 200 Ghanaians into Ghana who were living in Kuwait. So, with your permission, I'll invite the Honorable Charles Oredu, the Deputy Minister for Foreign Affairs and Regional Integration, to update us on the deported Ghanaians from Kuwait. Thank you. I'll encourage other speakers to kindly use the hand sanitizer as well.
Good morning. I bring you greetings from the Foreign Minister, Honseli Ayekubuchi. Okay, so following the decision of government to sort of restrict the movement of people into the country, a lot of Ghanaians, who were out then when the decision was made, found themselves stranded. They started making calls, I guess that you might have received some of these calls. Some went to our missions, that's our embassies, and made a pitch that anytime such an opportunity is given, say if government was ready to evacuate Ghanaians, they were ready and willing, to be part of this group. Following that, His Excellency the President had a of Ghanaians, how Ghanaians were faring. The ambassadors did tell the president that some were sort of stranded, they wanted to come home, some had completed their school, they wanted to come home. They gave so many other reasons. And, the foreign ministry has, a fiduciary duty to ensure that the welfare and security and interest of Ghanaians abroad are secured. Immediately after this meeting, these ambassadors were charged by His Excellency President to collate the data, because if we want to have any informed decision, we need a data, like the President has already said, that whatever decision that is going to take regarding this pandemic would have to be, fueled or backed by science or data. Following that, we received this data, information from Ghanaians stranded all across the globe, some from Afghanistan, some from Yemen, some from Benin, some from the US, the UK, Nigeria. Okay, so once we got this information, we did some categorization. Now, there's also information then that the Kuwaiti government, was willing to cooperate with Ghana to bring home some of our compatriots, who found themselves stranded in that country. So per the categorization that we did, that to us, in terms of whatever decision that government takes, we thought that it has to be phased, that you had phase 1, phase 2, phase 3, phase 4. So in terms of our categorization, we listed this group of people from Kuwait as the first category if any decision is made by government, to bring our compatriots home. We also had people who traveled on their own, and as a result of this closure of the airports, came out to say that they were willing to pay once an arrangement was made. They were willing to pay for the cost of the flights back home. They were willing to pay for the cost of quarantine. We also had categories of this category had to do with those who have traveled on behalf of government. I say those who travel on behalf of government, that means like somebody working with any of the government agencies. You can be working for, say, Ministry of Information, for example, and you have gone for a conference or a meeting somewhere, and because of this decision, you are need to come back. So you have traveled not on your own, but because you are on there to represent the interests of government. So these were the second. And under this, we also had students, some who were on government scholarship. So they were sent there to study on behalf of government. They finished their studies. They wanted to come back home, and they found themselves stranded. Then we had the other category of people who went there on their own. Immediately this closure or this closure was announced, they couldn't come back. The little money that they had on them, the little money, they started using them, and now they are broke. So we say they are destitute. As a result, even if you make an appeal, or even if you provide an aircraft and ask these people to pay, they cannot pay. Okay, so these were the categories that we found. Now, in terms of the phase, the names or the numbers were such that at a go, government cannot take a decision that all of these people should come in at the same time. No, it's going to be very chaotic. Because if you look at the numbers, even where to even be quarantined when they in, the kind of kits and all that. So the decision was taken that, okay, let's start with the Kuwaitis. And with this, we said that before they are brought in, firstly, they would have to make sure that they've undergone the test. So this group of people who are initially we told the number was 245, but subsequently when they landed and we did the reconciliation, we arrived at 230. So they underwent the test, they went through the test, and they were issued a certificate on the day of departure. So that day, this group of people, that's the first one, they landed on Saturday in Accra. They were all there, led by the Minister of Aviation. We received this whole, and the process was so harmoniously done to the extent that there was no fault in terms of how this process went through. And probably, let me also give, gone through a simulation process, a simulation exercise that went on so smoothly. So when they landed, we just had to activate these protocols. They went through the, the normal immigration and all that, and but by 1 hour, they had gone through all the processes, the needed process, and they were taken to wherever the Ministry of. Let me use this platform to thank all those who contributed to that success, because it went on so smoothly. I want to thank the National Security apparatus again. I also want to thank the Ministry of Affairs, the officers there, because they also did a yeoman's job, starting from our mission in Kuwait. Then the Ministry of Health, through the Ghana Health Service, the ambulance service, and the Ministry of Interior, through the Police, Fire Service, and Immigration, the Ministry of Defense, through Ghana Army, the Ministry of Aviation, that's Ghana Airport Authority and the Aviation Security, the Ministry of Transport, they provided Ayalolo buses, to convey our compatriots, after having gone through this the immigration procedure. LATMA also played a yeoman's job. And yourself, the media, because you were there, to capture, to send the pictures out there, for Ghanaians to see that government really listened to the cries of, her people. We had an agreement with the Kuwaiti government. They brought people down for everybody to see that the people had landed. And I want to thank you and say that this is the first of a series of what is yet to happen. And as and when we are ready for the next group, it will be announced to you through the same platform that was announced. Thank you for your kind attention.
Thank you, Honourable Deputy Minister, for your detailed update. For our next brief, we would have dynamics of the coronavirus. During the lockdown, it was explained that the lockdown was for the purpose of enabling our health professionals to go out and gather enough data to be able to assess the dynamics of the coronavirus here in Ghana. As we all know, looking at the global data, the virus behaves differently in other countries, and we needed to know how the impact and how its dynamics here in Ghana. So we did get some data and some analysis during the lockdown, and every now and then the assessment and data gathering is ongoing. So we would invite Dr. Bedu Sarkodie to come up here and then update us on the dynamics of the coronavirus here in Ghana.
Thank you very much, Honourable Deputy Minister. Good morning, distinguished ladies and gentlemen. My task is very simple: to provide the updates on the dynamics of coronavirus in Ghana. And this is a pandemic which is not restricted to Ghana. So I'll use some of the data for comparison from other countries and try to answer the question as much as possible. When someone is exposed to the germ or the virus, there are a series of activities that will go on within the virus and also with the person. And it starts from anybody who is susceptible. That means that when you are exposed to the virus, you can have infection. And being a new virus that no one has known immunity, almost the entire population in Ghana, as well as the entire global community, are susceptible. Those exposed, susceptibles, exposure, you may be infected or you may skip the infection. So it's not everybody who is exposed that gets infected. Indeed, these are ongoing, and sooner you have the proportion that are exposed that are infected, but these are not very clear out there. Those that are infected, a good portion may be symptomatic or signs and symptoms, and a good proportion may also not show any symptoms at all. If you develop the disease, it may be a mild disease, with severe, critically ill, and some of them proceed to death. This is not one-way journey. From those at any point When you develop the disease is mild, it can go back to non-infected. And then also when you are moderate, you can recover, and then a few of them may succumb to this, unfortunately die. The more severe the condition, moving to critical illness, then the likelihood and chance of death increases. Ghana, we have 32 people that have succumbed to the virus as of now. You move into some of the characteristics of the virus. This is general, not related to Ghana alone. The COVID-19 disease is a coronavirus, and the name of this germ is SARS-2. Often we interchange this, but not interchangeable. When you are talking about the malaria disease, we have to talk about the parasite, which is the plasmodium. So let's get this right. Genetically, the SARS-CoV-2 is very similar to other human respiratory viruses. And then the SARS-CoV-2 infection starts as a small particle, enters the body germ, body cells, and then forces the body cells to make a lot of changes in that cells and pushes the body cells to replicate that virus into itself. And that is how we get the infection, number of germs in the person, and then they also transmit to others. The SARS-2 infect cells that have specific protein in the tissue. Is getting a bit technical, bear with me. I'll do best to explain in the simpler terms. This ACE2 are what the virus uses to enable it to enter or penetrate the body cells. And then the more the body tissue has this ACE2, the enzyme, the likelihood the germ can enter it and cause destruction. And the organs and tissues within the body that have this include the respiratory tissues and also gastrointestinal tissues. Some of the cells have some miniature aspects of this ACE2 or the protein. The SARS-CoV-2, the spread is from person to person, and then later you go a bit into the details. How does the virus make people sick? The virus of COVID-19, which is the SARS-CoV-2, goes in a specific type of cells, and how they penetrate, I've mentioned them. Within the lungs, the penetrating lungs make some secretions and then used to enter the cells. The virus damage the tissues of the host, and in attempt for the body to defend itself and repair itself, it brings quite a number of cells that come in trying to attack the virus, also end up forming certain outputs that may not be very tolerable to the body, and this is how disease starts. If this accumulates a lot within the lungs, then the respiratory symptoms, the breathing difficulty, and those other conditions do happen. Millions of cells from the immune system invade the infected tissue and cause massive amount of damage in the process of trying to clean up. And that is how it ends. We as health workers, the challenge that we have, how do we support this individual of this condition as the body is trying to repair itself? There is a sliding scale behavior of this virus, and the virus, those children under 10 years, they clear the virus rapidly, and those people over 40, under 40 years, up to 40, 10 to 40, when they become diseased, they recover earlier. I'm mentioning this, when you compare this to the figures in Ghana, you'll see how we behave, we stand as a country. And the same protein, the ACE2, that helps the virus to enter, the same mechanism that the body uses to regulate the blood pressure, competes with it. So if the virus goes there first, the body can't control the blood pressure. So realize that people with high BP, the hypertensives, when they have the infection, then the tendency to develop severe, critically ill, and unfortunately succumbing to the germ is high. And that is why when you mention comorbidity, these are some of the rationale behind science, behind the term that we use. The status of those people infected that develop symptoms versus those that don't develop symptoms at all, about 9% of the people infected develop signs and symptoms. They are symptomatic, and up to about 91% have no signs and symptoms at all. Let me come to some aspects of the transmission. COVID-19 is transmitted mostly through droplets and fomites during close, unprotected contacts. Close, unprotected contacts. So when you're preaching, use face masks, wash your hands. These are protective mechanisms. So in close relation, these etiquettes, these principles, these protective mechanisms should be adhered to in most strictest terms. Airborne spread has not been claimed or designated, but then there's still the research is ongoing. There have been instances where fecal shedding has been reported, but whether the virus can be transmitted through fecal-oral transmission still has not been demonstrated yet. With regards to house transmission, secondary attack rate has come up to about 3 to 10%, and studies elsewhere, particularly in China, have indicated that when in a home or group of up to some number of people, about 3 to 10% of them may develop the infection. But let's remember, the dynamics in China is the same as that in Ghana. Still, an aspect of transmission, individual risks also depend on a number of factors. How frequently do you touch contaminated surface? You mentioned quite a number of times that when the virus is thrown out there through sneezing, coughing, talking, singing, and the germ drops on body surfaces, if you touch such surfaces and rub your eyes, rub your nose, touch your mouth, or put your hand in the mouth, without having adequately cleansed the hands, you can get the infection. So the risk factors depend on how you touch surfaces, how frequently you rub your eyes, rub your nostrils, put your hand unprotected, unclean hand into the mouth. And then clearly frequent cleansing of bodies, which you call fomite, areas that can be common source of transmission like door handles, doorknobs, surfaces like here, mobile phone, if you share mobile phone, in the office, if you share pens, somebody infected, if you share the pen of such individual, the likelihood of getting the infection from somebody is high. So we have to take note of this and then see how you prevent and protect against the virus. Healthcare setting potentially could be a source of transmission. We have some big name for it called nosocomial transmission. We have quite a number of health workers that have been infected here in the country in other areas, but clearly it has not been demonstrated that the healthcare setting and health workers are a source of transmission of this virus in the country. This has come from training the people to know how they would use the requisite protective equipment to protect themselves. If unfortunately they have any signs and symptoms, they have to report early. Unfortunately, if they develop any condition, how do they handle themselves and be truthful and sincere and faithful to the people of Ghana so that they report and they get the needed support without transmitting the germ through health service delivery. We have not had any instance where the healthcare setting has been a source of transmission in the country. There are certain settings, like the prisons, where you have a lot of congestion. Should there be infection there, the likelihood of transmission is high. So we need to develop mechanisms to ensure that you protect the inmates adequately so that nobody goes into these areas with the infection. And that will require that probably should there be somebody moving from out to the inmates where the people have been there for some time, We have quarantine cells for them to stay in. We will be moving to some of the details with regards to the charts that we have. In signs and symptoms, the commonest signs symptom is cough. In Ghana, it's about close to 30%. The most symptom elsewhere is fever, but then here in Ghana it ranks about 30%, and the rate of fever among those that we have picked come up to just over 10%. This may be the reason why the travelers, when we are using the thermometer gun and other means of temperature checking, you don't pay, because here, most of them, you don't wait till severe disease to pick them. But then the symptom fever that the temperature gun monitors, mostly the rate's low here in Ghana. With respect to progression and severity and outcome, the severity of COVID-19, I wish to say it varies. The disease may take a mild mode without any symptoms and then may resemble any acute respiratory illness. The mild cases typically recover within 2 weeks, and the viral shedding is complete. In the extreme, when they are admitted, sent to hospital, some of them made to intensive care, it may end up to 8 weeks. So if they don't die, unfortunately, they may recover. Children form a small proportion of those cases reported, and children under 10 are about 1%. Those 10 to 19 years of age form about 4%. Children are likely to have milder signs and symptoms and higher chance of severe disease than adults. The risk of death is about 0.5% among people that are young, and here in Ghana, it seems to be even the entire or the total fatality rate for us as a country. Pregnant women may be at higher risk, but then some studies also, that's the H1N1 outbreak, indicates that this virus doesn't seem to have preference for pregnant women, and that the reduction of their immunity doesn't seem high. But then there's still a new virus that we are studying. We cannot be very patient on this, so we have to take steps to protect our pregnant women. Still on severity, severe cases are defined as rapid breathing, that's tachypnea, because it affects the respiratory system, and then often the breathing rate does not reach up to 20. So if you have breathing 30 and over, you say you have tachypnea, which means that your rate of breathing is faster than what is expected. The oxygen saturation tells us how the oxygen air that you are breathing enters the body and provides the necessary oxygenation to the body. If the pressure, the flow meter of the oxygen comes to less than 300 meters per mercury, then the saturation is low. And these are things that we monitor when we are monitoring the cases to ensure that the saturation is within reasonable range. Critical cases are defined as respiratory failure or other essential organ failure requiring mechanical support or life support. And as much as possible, the baby shock, other organ failure, including kidney failure, are some of the end results. And these, unfortunately, are some of the reasons that some people succumb to it. About 25% of severe and critical cases would require mechanical ventilation, and as a country, we need to prepare for it. And those that will require oxygenation come to about 75%. With regards to comorbidity and deaths, the overall case fatality rate and the location transmission, in China, it was earlier high and later it dropped. I'll come to the figures in Ghana later. I'm mentioning China because that's where the infection started, and they have had enough time to study the virus adequately, and you need to use some of their reports. And the case fatality was high, later it dropped. The fatality increases with age. mentioned it earlier, the older you are with the infection, the likelihood of developing severe illness, and those with severe illness and older you are, the unfortunate things may happen, and this is death, and it happens with increasing age. There is the need and call for protection of those that are vulnerable. We are mentioning this just for the sake of mentioning that if somebody is old, the person is likely to develop severe illness. So if we are putting in mechanisms to prevent and protect against the infection, the priority group of population that we need to protect. Those that are old and develop the infection, when it's severe, the likelihood of moving to the unfortunate event of death is also high. So those that are managing the cases have to put in measures to protect and monitor this old and aged very well, because they are at risk of moving to the unfortunate end, the death that cannot be reversed. Most of the people who die have pre-existing underlying conditions, and these conditions are hypertension, diabetes, mellitus, cardiovascular diseases, and those with chronic respiratory conditions are also high at risk. According to some reports, the median time between onset of symptoms to death I'll mention is about 10 days averagely, and 5 days in hospitalization. Some of these people may succumb to it. The median time for exhibiting initial symptoms death mentioned earlier, 14 days, and it may range from 6 to 41 days. Smokers have been observed to be higher risk of death, and also with severe signs and symptoms when they get the infection. So you have to also, in our message for prevention, you need to discuss this. What are some of the response strategies? The strategies developed in Ghana with the goal to prevent and protect against. We have segregated them into districts with cases, those without cases with hotspots. The districts and areas without cases, the strategy is to strictly prevent introduction. This requires quarantine facilities, temperature monitoring, and then also strengthening triaging when people are entering these areas. So it's very important. The areas with sporadic cases, there are some tricks with 1 or 2 cases. We need to mobilize the various response actions, and then also prevent further importing, prevent exportation from this area, and strengthen treatment mechanism. Areas with community transmission and hotspots, there's a need to, in the most strict sense, the various prevention and control measures have to be adhered to, and we have to put in mechanisms for isolation, contact tracing, and all those good things, 3 T's that have been put in place, we should go by it. Brief care and treatment. Patients are treated according to the National Treatment Protocol and Guideline. No specific antiviral agent available as at now. There are some that we are using that even some of them raising questions. So what we do, provide the needed support for signs and symptoms, and then also supportive treatment if they require any ventilation and other organ support to let this person survive the critical age and come back to life. All patients are monitored using pulse oximeter, supportive treatment, and asymptomatic for all of them. Treatment using the various approved guidelines from areas and countries that developed the condition earlier is what we are using here. Some of the conditions, even comments have started coming on them. You review this, and if you need to revise our treatment regimen, you do that accordingly. Patients are discharged after care recovery, that for 3 days there is no fever, and that for 2 consecutive periods at 24 to 48 hours, this person, having been positive, has later tested negative in 2 successive intervals periods, and then reverted to negative. Upon discharge, we ask such a person to continue to adhere to the various preventive mechanisms that have been outlined earlier for the general population. The chart that you may see next is the sex distribution for those in the country that are infected. And then earlier, the male, female about the same. At a point in time, they'll take over, and then more preponderance for men in the country. This chart is the distribution of the entire number of cases that we had as a country plotted against the time samples were taken. This chart should have been, if the people are coming to the hospital, you ask them when the signs and symptoms started. The model that we adopted in the country Ghana, you don't wait for people to get sick before you go to them, and you go to their homes. Not most of them not coming to the hospital. So when the signs and symptoms started, you may not have all. Even majority, more than 50% may not have signs and symptoms at all. The best closer to should have been when they went to the hospital, the time they were seen. Again, most of the people, we visited them to the home and not waiting for them to go to hospital before we tested them, identified them, and started supporting them. So again, that data, the closest is when the sample was taken, and that is what has led us to this chart. Those that have died, the next slide is what we see here, and I think there is no day that we have more than 2 deaths. The maximum number of deaths for a day is 2, and that is the situation in Ghana. The next few slides just put them together: the admissions, the discharge, the deaths, tested 2 negative. These are situations that we have. You use East Hospital, Hospital. That is where we have the majority of the cases, and that is the situation that we have. The next few charts up to where you have the guide, the continual chart are all about admissions, about the deaths, about the stress. The comorbid conditions. Move on. Yes. We have the total number of deaths for now span up to 32. What we have here, when you add them up, you will not add up to 32 because one person may have 2 or more comorbid conditions. And we put them based on the number of comorbidity that are available. And the commonest is tension, followed by diabetes, asthma, and the rest that you can see out there. Then the proportion that have comorbid conditions are 9.4, and those, proportion without any comorbid condition, 9.4, and those with comorbidity, 90.6. Again, the next slide is what is happening here in the country with regards to the various deaths. And the chart here, next one. Yes, the sex and age distribution of the various, and you realize that clearly as you progress along the age brackets, the rates of death increases. And then the distribution of deaths by region is what we have the next. And then the cumulative number of recoveries. You realize that it was down for some time. The people, at a short time, Ghana, we tested and got quite a number of them that were not due for assessment for recovery. When we were ready to assess them for recovery, there were also quite a number of people that were waiting for their results to inform how you should manage them. We expect when to do these things, and then at a point in time, when the pressure in the lab reduced, we started testing these people that are observed for more than 14 days and were due for reassessment as recovery. And this is the picture that we have. As we speak now, we continue getting more and more reports from the region, and even before we leave here, the situation may change. Honorable Minister, Honorable Senior Minister, distinguished ladies and gentlemen, I will summarize and conclude saying the following. COVID-19 pandemic is ongoing active in a number of countries, including Ghana. Ghana started the year 2000 preparing for COVID-19 at the time we had an alert based on what was happening in Wuhan, China. At a point in time, we moved from our preparedness mode to response when on the 12th of March, we confirmed our first case. We immediately switched from preparedness to response mode, and a number of interventions and response actions were put in place, which includes border closure, restriction in social gathering, social and physical distancing, the use of face masks, enhanced hand hygiene, enhanced respiratory hygiene, and others. These are the non-pharmaceutical interventions that are key to control the pandemic as we await the discovery of vaccine and cure for this virus. The NPIs, or the non-pharmaceutical interventions, have impacted positively here in Ghana in respect with our morbidity burden and also the death burden. If you compare to a lot of countries, the morbidity seems to be acceptably low, and then the death toll also up to 0.5% or 5 in 1,000. Indeed, when you compare to other countries, this is acceptable. The virus is here to stay. We need to agree on which of these measures we can adapt and institutionalize for long-term use as we plan to live with the virus in good health and imitate the socio-economic impact. Your Honor, Senior Minister, Your Honor, Deputy Minister, I think I'll end here for now. I thank you very much for the opportunity.
Kodia, for the elaborate analysis on the dynamics of the coronavirus here in Ghana. We can only get better and act better with this kind of detailed information. With your permission, I would like to acknowledge the presence of the Honorable Senior Minister, the Honorable Yao Osafo. In my earlier intro, I left out one major brief that we'll be having today as part of our topics today, which will be the deployment of 10 additional ventilators to selected health institutions. So later this morning, the government of Ghana will receive 10 pieces of ventilators from the P-Wood Limited and Temabonda Terminal as their contribution to support the efforts of government of Ghana in the handling and management of the pandemic in this country. The ventilators being donated this morning have the same specifications as those being ordered by Ministry of Health. And the Honorable Senior Minister right here will receive it when we are ready on behalf of government. For now, we'll take our update on case count and case management from Dr. Patrick Kuma Abuaji. Please come up.
Thank you very much, and good morning all. Honorable Senior Minister, Deputy Ministers, colleagues, and the media, I think that Bedisa Akode has made my work a lot easier. I don't have to do too much explanation about why we have certain figures and why we are managing them. So I'll be as brief as possible. As at 24th of May 25th, a total of 156 new cases have been recorded in Ghana. And this shows the new trend of showing much fewer cases. The cases were identified in 5 out of the 16 regions. Greater Accra contributing about 72 new cases. West Region 57, Central Region 13 cases. Volta Region reported an increase in 10, and Ashanti recording probably the lowest figure ever of 4 new cases in a day. We will do more about West Region, which is becoming a new hotspot, a phenomenon that we have gotten used now. So if you go into the full details, you will see that based on all that, the total count, cumulative count in the country is 6,964 cases, out of which 2,097 have recovered, and I'll keep on saying that this is still a tip on the iceberg, because as we ramp up testing of those who have recovered, we will get a lot more. There are 15 cases who are severe. I'll give you details of where they are. And as Dr. Bedisa Akode said, those who are critical, we don't have anybody who is in the critical position, they don't need any ventilator. We have recorded 32 deaths so far. For the confirmed cases, treatment outcomes, out of the 15 cases that I say are severe, none is on ventilator, so there's nothing, nobody is critical. We have 4 at the UGMC, that's University of Ghana Medical Center. This has 3. Ho Teaching Hospital has 1. Kolebu Teaching Hospital have 1 in their World Class 3. Kumasi has Konfanoche, and 30 Military Hospital has 1. We have about 800 people in isolation across the country. Half of that, or more than half of that, are in Accra, the Pentecost Convention Center, and the rest are in various centers, isolation centers in Ashanti, and some of them are in hotels in the rest of the region being isolated. When you go into the regional distribution, the next slide, as I mentioned, we have had about 10 regions have not reported a case. Greater Accra, the details are there. So they have so far recorded about 4,835 cases, accounting for more than 80-85% of all the cases in the country. We have Ashanti recording 1,062, but they have 4 new cases today. Central has a cumulative figure of 306 with 13 new cases, and I'll give you the details of where the districts are coming from, because those are very important to us. Eastern has not reported a case for a while. Upper West, Upper East have also not reported a case for a while. In fact, most of the cases in Upper East, they have almost recovered, and so one can probably start seeing them some level of clean sheet. In fact, their treatment center is temporarily closed until they have a new case. Volta has 10 new cases, but they have a T has 26 cases. They've not had any new cases since then. And then we have Western has had 2, 1 died, and 1 has recovered. And so they are probably in the same state of currently no case. But this is not to say that because of that there's no doing a lot of sublimation also did not show any case. So broadly, this is where we have. The new issue is the distribution. In the distribution, we still have the same number of core districts in Greater Accra. The next slide, please. Yeah. Where it's mainly in the Accra metropolis, a bit of Tema, Shama. Even Tema is showing some decline, but because this figure is showing cumulative figure, you think that there's calving, but they are virtually not on the list of people who have been presenting positives today. Ashanti region also remains another key area where the Kumasi Metro and Obuasi, but Obuasi is really under control, and they are reporting virtually no case now. The new case has come up. The new hotspot is in Western region, who reported about 57 new cases. And these are currently we're going to do, because it looks like one of the new hospitals surgeon is mainly in the Takoradi, Secondary Takoradi municipality and Metropolis, and then Takwa. So a team will be going to see how we can quickly assist the region to bring it under control the same way we did in Obuasi. Even though the region has already isolated and identified, self-isolated the people and are doing enhanced contact tracing to grade containment. We have had a new case, first case in Savannah, and for the very first case that they had. This is a 31-year-old who works in Salaga but lives in Tamale. The sample was taken on the 15th as part of our enhanced surveillance. The regions that do not have a case, we continue doing sets of at-risk people, and this is how this person was picked. So the case was picked in East Gonja. The person is asymptomatic. He's cooperative and has in self-isolation in Tamale. He had 12 contacts. The region had identified 12 contacts, some in East Savannah and some in Northern region, and they are all being filled up for the next 40 days. The daily follow-up and clinical review by psychologists has always been done, and this is ongoing. Before I go, I think I also want to add a bit about the team, the people in who returned from Kuwait. On Sunday, about 230 of them had their samples taken. They are currently in the lab. Once we get the results, those who are positive will be moved to the treatment or isolation center, depending on the situation is, and we watch them, and then within the 14 days, samples will be taken as part of our contribution to the exercise. We have health workers there. We have doctors, nurses, and ambulance services there stationed at the center to provide full care, including psychologists, to provide them with care. So, ladies and gentlemen, in conclusion, we continue to see more regions, and this is not reporting new cases. And we also having reducing incidence of cases in the last few weeks. The phenomenon periodic flare-ups of cases in certain communities continue to come up. This one is more about the Takwa and the Takoradi, but the response remains swift, and we gather all our energies to go there and contain it. The deaths, as I said by Dr. Producer Akodie, also remain low and stable, and we are hoping that this will continue as we fight this disruptive virus. Thank you very much.
Dr. Patrick Aboagye, we are grateful. At this point, I think we can start with our questions. If any questions, please come up. Because of social distancing, we have some of the media houses here, representatives of the media houses here, and then there are some others who have sent their questions on social media to Kweku. So as and when we are done with questions here in-house, we'll take the ones that were sent to Kweku directly. If you can space up a little bit more, please.
Good morning. My name is Salom. I work with TV3. So my question first goes to the Deputy Foreign Affairs Minister. In your briefing, you said that looking at the numbers involved, government couldn't have evacuated all the guys outside at a time. So we want to know what are the numbers. Beyond that, is there a firm decision by government to evacuate Ghanaians abroad? Also, we have news some Ghanaians stranded in Holland are going to come back home because those who are also from Holland stranded here are also being allowed to go back home. We want to know whether you can confirm that for us. And then to the Director General of the Ghana Health Service, the WHO has stopped trials with hydroxychloroquine. So we want to know what the position of Ghana is on. Are we using it, and then have we used it on anyone that probably died afterwards? Thank you.
My name is Komla Adom. I work with Joy News. A couple of questions. I want to know if there's been an amount or a figure put to the treatments and the testing of these 6,000 plus people that have tested positive so far, and the treatment that have been given to them, plus the Deputy Foreign Affairs Minister.
Can you come back again?
How has it cost the country to test and treat over 6,000 people that we have who have succumbed to COVID-19 so far? And also, how much did it cost us to liaise with the Kuwaiti government to get the 230 returnees back in the country? Then my other question to the Director General of Ghana Health Service. We continue to hear stories about PPEs. I'm even fatigued and tired about hearing these things, but we keep hearing them. The Ghana Registered Nurse Midwives Association recently said about 288 of their members, at the time we spoke to them, were on quarantine. The last time we spoke to them, 41 of them had tested positive. Now it's crossed 50 or 60 actually. Is it the case that these frontline workers who are helping us live are not well protected enough to do the job they do, that they keep getting infected? And I'll give a quote from the General Secretary of the Registered Nurses Association. There's these individuals who are testing positive, surprisingly, are not those who are working in the treatment centers. These are people who are on the periphery, as he calls them. What is happening? Thank you.
Yes,
my name is Derek Adote from Metro TV. My first question goes to the Deputy Foreign Minister. I want to clarify, are the Ghanaians coming from Kuwait immigrant illegally coming from there, or just because clearly reports indicated earlier that these people are illegally staying in Kuwait? So are they just getting stranded over there because of the border closure, or they are illegal immigrants? And secondly, I want to ask if there's an update on the employment of nurses, unemployed nurses staying at home, since it was said earlier that they will be employed to support in the fight against COVID. Thank you.
May I know if we have any questions on your side as well? You want to come back? They are not ready, or okay. Colleagues, I was trying to save you from doing back and forth on the podium so that we could put all the questions together, but some of them are not ready. So, Honorable Charles Oredu, I think
Welcome back. This is the extended version of Breakfast Daily, and there we heard from the Information Ministry. The case count of COVID-19 in Ghana is now at 6,964, and the recoveries have also gone up to 2,097. So that's great news for us as a country.
Yeah. I mean, I think that all round there's a certain positive vibe to the information that we got today. One of the things that Dr. Patrick Kumabwaje was breaking down for us was looking at the case counts region by region, right? And he says that there's a general slowing down of the numbers, when you go region by region. In some places, some regions are not recording any new positive cases. In the places where they are recording, a lot of the places seem to have slowed down. Of course, then you have places like Takwa, for example, where it's a sudden spike, and then the team has to rally around, go there, and aggressively deal with that situation that is happening there. Of course, a couple of weeks ago, Obuasi also flared up, in a similar fashion, and then they will send the team there.
There was a Tama case as well.
Yes, so I think that generally it looks like we've gotten to a place where we look comfortable in dealing with what's going on. We're understanding more how the virus behaves and how the spread is happening and so on and so forth. And I think it's looking good because for me, the jitters come from the fact that you're not sure what's happening, where is it going, and so on and so forth. So far, it looks like we've gotten rid of those initial jitters that we had before. We're a lot more comfortable. Dr. Bedusa Kodi also went through some treatment protocols, and he was talking about the fact that there's no specific treatment that they are using. But I said most of the time, the symptoms will go away on their own. Doctors can relieve symptoms by prescribing pain or medication, fever medication, and so on. And then there's also the suggestion here on the website of a room humidifier or hot shower can also help with sore throats and coughs. Drinking lots of fluid, getting a lot of rest as much as possible, and all that. So there's a general sense of it's here. How do we deal with it? It's here now. How do we not panic, and how do we adjust our lives and continue to move on and live basically, and all that. So that's one of the sense that I got from them.
We're going to go over, and at this point, we're doing a Q&A with our colleagues who are there, so we'll continue with them and then get back on Breakfast Daily.
Like a decision to bring in all Ghanaians. But this category, that's the Kuwaitis, they are the ones that a decision was made, to bring them in. So I think that clarifies the situation. Then, Joy. Okay, you wanted to know the cost. Then I just said that Ghana government will bear, the cost of their quarantine and feeding and whatnot. The Metro TV. I wanted to know the status of like those who arrived Saturday. I wanted to know their status because if whether they are stranded or deportees. I don't want us to get ourselves bogged down with this nomenclature. They are Ghanaians who are there. The Kuwaiti government, made an offer to the Ghana government. The Ghana government took this offer because it's a blend. You have some who were students and had completed school. They wanted to come back, So I don't want us to go through the list of the category, like the list of people who are back. There are people, they are back. Let's welcome them. Let's make sure that they go through the necessary protocols that they are supposed to go through. Once they are okay, then they are released back to the society. Thank you.
Like Kweku's questions are ready, so we'll take that in addition and then answer them all together.
Thank you very much. The first question is, per Ghana's COVID-19 records, does the Ghana Health Service have any of the recovered persons being reinfected again? That's the first question. The second question is it the responsibility of district assemblies to feed the COVID-19 patients isolated in their districts, or is the responsibility of the Ghana Health Service? What happened to the 15 Ghanaians, because the Ministry of Information earlier announced that the number was 245, and I guess the Deputy Minister explained that the final number was 230. And the final one is government supporting Ghanaians stranded financially to survive while awaiting evacuation? Those are the questions. Thank you.
Abu Charles, I think you just take that up, and then we'll do the others with the health professional.
Okay, so the questioner wanted to find out whether the missions were supporting Ghanaians, who are stranded. Okay, so we are in daily, touch with our missions, and like I said earlier, one of the key things that we need to do as a mission or as a government is to make sure that we seek the interest and welfare of Ghanaians abroad. So if you have somebody, one of us, who is there and as a result of this is unable to take care of himself, the missions don't have, the sort of money there that will be used for such situations. What we've asked the missions to do is that as and when these requests come, quickly let them found it difficult to even got them some monies, to take care of these Ghanaians. So as and when these requests come, quickly we take action to make sure that Ghanaians there or Ghanaians in such jurisdictions don't suffer. So rest assured that if you have a situation or if you have such family members who are there and they are facing such difficulties, they can get in touch with the missions, and once the missions write to us, we take the decision. Thank you.
There were other questions from Joy News that were addressed to the Ghana Health Service, particularly the cost of treatment and then the cost of testing. I think the Ghana Health Service may be able to take the cost of treatment, but hopefully in our next briefing, Noguchi would be able to give us the briefing for the cost. Take both of them. Okay. And then the issues on PPEs as well. And then there was a question from Quick's team on reinfection of previously infected persons. And then the issue of unemployed nurses. Would you be able to throw more light on it, or would have to invite the minister over? And then there was a question on the district assembly. Are we taking the nurses' employment now or in our next briefing? So we'll stand down a question on the unemployed nurses' employment for the next briefing, please. So please come up.
Thank you very much, Honorable Minister. I'll take the cost aspect first, maybe for the lab. We've so far done about 20,000 plus tests. And the conservative estimate for each the extraction, the operational costs, and the human resources costing about that. This excludes the cost of picking a sample and delivering it to the lab. And so it's quite a very expensive undertaking, but it's worth what we do. Doing. Treatment, I will go all the way to the ventilator. Obviously, the cost of care is quite high. And the Ministry of Health picks up all the bills routinely to look at how these are managed. So we will need to do some further costing to see, on the average, how much it costs to treat a person. We have a figure, but it ranges from mild, moderate to severe and critical cases. I believe that the PPE situation has significantly improved, but having PPE is another, using them appropriately is another. And that's why, from your own explanation, that it seems to be affecting those who are not in treatment centers. And because of that, that's why we are doing the charging to ensure that we are able to, as much as possible, isolate potential patients who have a case or need to significantly protect our health workers. These are those who we have to respond to this pandemic. That you may also not know the case who has, because most of them are asymptomatic, and so once you are exposed, we have protocols on trying to do the quarantine as we do for everybody. If we find a case here, some people will have to be quarantined while we retest them to see they are exposed. But to address that, we've intensified the training, further training on infection prevention and control across the facility, especially outside the treatment centers where they are more careful. And we implore all to abide by these principles. We have also started training our mortuary workers and other workers who are likely to come close to this thing, just to mitigate this matter. So it's something that is worthy to be, and that's why we appreciated that it's a race not only in Ghana, across the country, and that's why a lot of effort is made to protect our health workers. District assemblies, yes, we have to really be grateful to them. They usually come to our aid, especially in an emergency where you need to quickly quarantine or isolate people. Immediately you find a case before the system responds to this. Say yes, a lot of assemblies have done that, but now the ministry and the RCC are collaborating to ensure that these things are taken up effectively. We do not have any evidence of any reinfection in Ghana. We discharge you. We had 2 negatives before we are discharged. But since then, we've not had any. But if you have negative and positive, we'll keep you until you test negative on 2 occasions before you are discharged. So I think basically those are the questions that I have to answer. You have yes. WHO currently, in a news item, have discontinued the use of hydroxychloroquine on safety grounds. As I speak now, of course, we wait for the formal communication, but the case management team now are meeting to take a decision on what to do. We only use it for critical cases. We don't use it for routine cases. Those who are being managed at home do not take hydroxychloroquine. So the case management team is, as we speak, are in a meeting to quickly take a decision on what we do. And whenever we do, that they will be adequately communicated to all. Thank you very much.
Thank you, Dr. Patrick Kumabwaji, Director General of Ghana Health Service. Earlier on, I mentioned the deployment of 10 additional ventilators to selected health institutions. And these ventilators are being received from Peawood Limited and Tema Bonded Terminal. I'll give a brief intro about the Peawood Limited. Mr. Eduartha, the founder, the Chief Executive Officer, and the Chairman of the Peawood Limited and Tema Bonded Terminal Limited, as part of its corporate social responsibility, has donated 10 ventilators to the government of Ghana to help fight against the spread of the dreaded COVID-19 pandemic in the country. He strongly believes we are all in this battle together, and this is not a fight that should be left to government alone. He trusts these life-saving ventilators will be put to good use. The ventilators have the same specifications as those being ordered by the Ministry of Health. Distribution of the ventilators will be as follows. Gapoha International Maritime Hospital, Tema, 2 ventilators. Tema Government Hospital, Tema, 1 ventilator. Komfo-Anokye Teaching Hospital, 2 ventilators. South Suntreso Government Hospital, 1 ventilator. Sunyani Regional Hospital, 1 ventilator. Ho Teaching Hospital, 1 ventilator. Oda Government Hospital, 1 ventilator. And Yilo Krobo Municipal Health Directorate, 1 ventilator. Kindly note that the choice of the institution, that is the various hospitals, was at the discretion of the donor. And the manufacturing company will move round to the parts of the country mentioned to do the installation, and then after hand over to the health professionals there. So we would invite Mr. Edu Abwaji. I'm sorry, I've been calling too often today. Mr. Edu Arthur. Oh, you are here, I'm sorry. And the senior minister is here and will receive this on behalf of the government. So, Mr. Edu Arthur, you have the podium to say a word or two to us, together with your team. Everything you want to share with us, we are ready to listen. And I understand your machine is fixed in the vehicle now. We are not able to transport it into this hall. So after you put your word through, together with our friends in the media, would go, and then you can hand over to the senior minister, and our friends in the media would be able to take the necessary pictures of it and then report adequately. The podium is yours. The staircase is right here.
So, my name is Yasmin, and Mr. Edu Arthur, he's the CEO and founder, as Madame said, of Peawood and Tema Bonded Terminal. So he's, convicted that everyone should really help governments to fight this battle, whether individually or as a corporation. And as a corporate social responsibility, this is his contribution to government's efforts. So appreciates everything government is doing for the country. Thank you.
Thank you.
Government of Ghana is grateful. Ghanaians are grateful. God bless you. In the absence of no further questions, you have some clarity to do. Senior Minister, Senior Minister, one moment. Okay.
Thank you, Honorable Minister. Before we receive this, I think in my estimation of the number of tests, I got it wrong. We've had about 202,130 tests done so far, 56,010 from routine surveillance. We've done 144,000 for the enhanced surveillance, and for those we quarantine, we did about 2,040 tests. So that brings the number to 202,000 tests and not 121,000. Thank you.
Thank you. Senior Minister.
Honorable Deputy Minister for Information, distinguished medical personnel, Director General of Ghana Medical Services, Boss of Ngushi, distinguished media. We are indeed very grateful to Mr. Edu Arthur, the Chief Executive Officer of P. Wood Limited and Tema Warehouse Company Limited, for this kind gesture. The most important equipment in the fight against COVID-19 is the ventilator. And we're happy that so far the disease has not pushed our people on it. But it's better to be prepared than not to be prepared. And this preparation is essential. We are therefore very grateful to Mr. Edward for assisting the government to prepare against the fight for COVID-19. We noted that he had himself distributed 10 to his preferred choices. One thing we can say is that we'll make sure the Minister of Health does not disturb the distribution. We would adhere strictly to his distribution, but as it was pointed out by the Deputy Minister, these are to be installed, and therefore wherever they have chosen to send one to say who or that, they must make personnel available to do the installation for the Ministry of Health to make it useful for us. So, Director, thank you very much for this kind gesture. May I use this occasion also to thank our frontline medical staff for the good work done in the fight against COVID-19. The government feels very confident about the support we have received from the frontline medical staff. We feel very happy about the support we have received from our distinguished medical officers, from the Ngushi and all the other institutions carrying out the various tests. This disease has come to stay in a way with us. The whole world will never be the same as before. The changing pattern will have to change and change forever. And therefore, all the various measures put in place by government must be adhered to all if we are to succeed in the fight against COVID-19. I believe that so far, the government has handled this matter with the support of the frontline medical staff and our technicians in Ngushi very admirably from the world point of view. And we will continue to do the same until we overcome COVID-19. Thank you very much. I think we will move out to receive the ventilator on behalf of the Ministry of Health. And as I said, we will stick strictly to your distribution list. Thank you.
Hopefully in the next one, Kafim North will be part of it. with all due respect, if we could all move outside to where the ventilator is stationed, because of its size, we could not bring it.
So there you have it. We heard from the Information Ministry there. The total confirmed cases in Ghana now stands at 6,964. Total active cases are 4,837, and the recoveries are at 2,097. The death count still stays at 32, and we've been told to be careful in our workplaces. You know, don't go sharing pens with people, don't share laptops with people, the kinds of things, doorknobs. Be conscious of those things, because you may take all the precautionary measures. You get into your workplace, someone may be positive, and you can catch it from them because you're sharing a lot of things with them, and you're not aware that you could be passing on the virus.
Yeah. You know, and one of the things that he also explained was this whole issue of spending time in closed spaces, you know, and that thing now, WHO is saying, the CDC is still talking about it. It looks like that's now really the critical thing that we need to watch out for. That closed space interaction, you know, the aerosol effect in the closed space interaction. I think is a very important thing. One thing that was mentioned also was the health workers being exposed, you know, inordinately to the infection, you know, and I think that it's important for us to make sure that whatever it is in terms of PPEs, protocols, whatever it is that they need. One of the questions that was asked earlier was the fact that it looks as if people who are frontline proper don't have as many challenges as those who are on the periphery, but are part of healthcare. You know, you see, it seems that a lot of attention has been given to frontline people, but those who are in the periphery, and maybe I shouldn't use the word periphery because they are your first point of call, you know, especially like triaging nurses and so on.
Security guards.
Yes, security guards, orderlies, you know. We're not paying as much attention to these people, but they could be the entry points that will cause the spread, you know. It's interesting how human behavior works. Once you're with your colleagues, you feel safe and comfortable. But that colleague could have just walked in with the infection, you know. And also, this whole thing about testing, the mindset we need to have, I believe, is that you can be tested and the next moment you're infected. So you test, you come out negative, by evening you're infected. So let's not joke with it. You know, as much as we want to keep people calm and so on and so forth, I think it's important to remember that this is how infectious it is. Okay, you get tested, you're negative. You get home, you're positive, but you won't know. You see, and so we need to be cautious. I like the part you talked about, what you just mentioned, the pens and the surfaces of the red. You're working at your desk. Somebody has come to take your pen and gone to use it and come and put it back. You know, I think that we also have to get into this new habit of cleaning our stuff, you know, as often as we can as well, because that's really what it is, you know, where the infections are going to come from.
I completely agree. And we also got an update on the deportees from Kuwait. The government of Ghana will take care of the cost while they are here, as far as they are testing, making sure they are fine. We do know that you have to go through 2 phases. So first 2 weeks, if you're negative, you have to go out to another 2 weeks, and then you are discharged if you are double negative. But we know that the Kuwaiti government actually covered the cost of getting them here. And I'm sure we're going to be hearing more cases like that of Ghanaians wanting to come back home. How do we sustain that moving forward, as well as people who are stuck here and may want to go back to their countries?
The good news from that group of people, though, is that majority of those who have been tested so far came out negative, you know. So I think it's a good thing. that means that you just have one more negative test to come up and then you're good to go. You know, in the case where people are found positive, they still have to have 2 negative tests. So it means that you're going to have to, you know, go through the recovery process and then get your double negatives before you're free. Yeah.
Well, thank you guys so much for staying with us. Don't forget that tomorrow at 9:30 we'll be showing Hello, Mr. President. So if you have a problem that you would want the president to address, you have a little under 23 hours to send them over to us. So please send those in. If you do a video, 60 seconds, that's the maximum. Tell the president whatever struggles you're experiencing in your area and how you would want him to solve it. And if you want to text as well, the minimum should be, or actually the maximum actually, should be 250 words. You can send the videos in as well as the messages to our email, hellomrpresidenttv@gmail.com. You can also WhatsApp them to us at our number 0550-585-832. If you're outside Ghana and you still want to address the president, just use the country code +233 and we'll do well to show them on Breakfast Daily tomorrow at 9:30 and have a comprehensive discussion about them.
Yeah. So just make sure that you get all these links in latest by 7:30 tomorrow morning. All right, so that we can get your issues.
I would even say tonight. Let's do it quick.
Okay, right. So latest by tonight, before you sleep, make sure you send your videos in. All right. Thank you for watching Breakfast Daily this morning. My name is David Kokusichi.
And I am Jifa Ekia Ametam. Stay safe. We're going to beat this, and we will see you at 7:30 a.m. tomorrow. Enjoy your day.
Take care.
After the outbreak of COVID-19, it was critical to trace, test, and treat persons with coronavirus. Frontline health workers came to our rescue. They put their lives on the line for the country. They have a story to tell, a story of how they are coping with the battle to get rid of COVID-19.
At home, it's a bit of uncertainty. The children now, they look at me some way. Even the little one doesn't get close to me anymore. When they want to greet, they elbow you and then walk away. Because even my husband looks at me and tells me, as for me, once I am here, he believes the probability of him getting it is high because I can bring it home for him to get. But we are managing it, especially as a frontliner. The moment you cough or sneeze or have a feeling of sore throat, you start getting scared. It happens to me, but it just clears. We just tell ourselves, oh, this thing is normal. We have it before COVID came. So we manage it. We gargle with warm water. It hasn't gotten that bad, but when it gets that bad, I believe we'll do the steam inhalation, and then we don't forget to take our vitamin C too. So we are managing it. We are protecting ourselves and also protecting our families.
Okay,
Okay, so right from the beginning, it was an issue of being courageous, because you see the numbers day in day out keep rising, and people are getting really sick, people are losing their lives, unfortunately. So it became a matter of mastering courage, and then the